Difference between Fnac and biopsy and which is superior. 1. Fine needle aspiration cytology, Fnac. 1. Procedure. A thin, hollow needle is used to extract a small sample of cells from a lump or mass. 2. Sample, cells-only, cytology. 3. Use, quick and minimally invasive, used for initial diagnosis of lumps or masses. 3. Commonly used for thyroid, lymph nodes, or breast masses. 4. Advantages, quick and outpatient-friendly, less invasive and typically painless. Lower risk of complications like bleeding. Cost-effective. 5. Limitations, provides only cellular details, not tissue architecture, and may not always be conclusive, especially in complex cases. Less effective for deeper tissues or masses. 2. Biopsy. 1. Procedure. A larger tissue sample is taken, often using a thicker needle, core biopsy, or through surgical excision, to sample whole tissue histology, including cellular architecture. 3. Use, provides detailed and definitive diagnosis. 3. Used for solid masses, deeper tissues, or when Fnac results are inconclusive. 4. Advantages, gives complete tissue architecture for a more detailed diagnosis. Helps in differentiating between benign and malignant lesions with greater accuracy. Can assess tumor grade and specific markers. 5. Limitations. More invasive and may require local or general anesthesia. And higher risk of complications like bleeding, infection, or discomfort. More expensive and time-consuming. Which is superior? 1. Fnac is superior for preliminary assessment due to its simplicity, cost-effectiveness, and minimal invasiveness. 1. It's often the first step in evaluating a suspicious mass. 2. Biopsy, however, is superior for a definitive diagnosis. 2. It provides detailed histological information essential for treatment planning, especially in cancer cases. When to choose which? 1. Fnac, when a quick preliminary diagnosis is needed, and for superficial masses like thyroid nodules or lymph nodes. 2. Biopsy, when Fnac results are inconclusive or ambiguous, for deeper complex lesions. When tissue architecture and more detailed information are required, such as for grading cancers or identifying specific tumor markers. In clinical practice, Fnac and biopsy complement each other, and the choice depends on the clinical situation, location of the mass, and the information required.